everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched the simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with coalitions around the country to learn how communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, create a training around it, or add it to trainings that are already being held. To date, CADCA has held over 20 virtual screening events across the nation. We've engaged more than 2,000 participants, and we look forward to hosting more events this coming year and reaching countless new participants. Today, we are thankful for all of our partners and CADCA members joining us virtually, and especially thankful for today's hosts, the Drug and Alcohol Consortium of Allen County, who helped make today's event possible. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in Indiana who are working every day to save lives. We are honored for them to be part of this event. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and when and how to administer naloxone. From these events, we plan to learn how to use this technology, how to better save lives, and create a norm that every life is worth saving. Now, I'm pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined CADCA in 2021 and has been working ever since to help further CADCA's mission of safe, healthy, and drug-free communities. We're thrilled to have him with us today, and we appreciate his insights.
Thanks, Rachel. As you stated, I'm thrilled to be here for this very important event. I'd like to personally thank Walmart for their investment in this technology and for their investment in the people who will benefit from this life-saving training. I'd also like to extend a special thanks to our friends and supporters at the Drug and Alcohol Consortium of Allen County. As a fellow Hoosier from Gary, Indiana, I consider it an honor to be on with such impressive leaders from the great state of Indiana. Finally, I want to thank everyone on today's webinar. CADCA has a footprint in over 30 countries worldwide and more than 5,000 coalitions across the United States. We seek to train community residents and leaders to build and develop coalitions in their communities and reduce substance misuse by adapting CADCA's model for community change. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. Prevention is more important than ever. Recently, the CDC reported that over 108,000 drug overdose deaths occurred in the United States in 2022. This number may have leveled off since we experienced the highest number of overdose deaths last year, but there's still plenty of work to be done. Put it in perspective, that number would fill Lucas Oil Stadium in Indianapolis nearly twice over. This is tragic, and we have to do our level best to right this ship.
Together we are stronger. And as we train substance use and misuse prevention to coalitions every day of the year all across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. You are the true heroes in your community. The conversation being held today on this webinar is not unique. Our partners at the Drug Enforcement Administration recently launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. DEA's message then is still the same now. If you do not receive your medication from a licensed pharmacist, do not take it. We have seen what one pill
laced with fentanyl can do. We do not need to see any more lives lost. As DEA Administrator Ann Milburn shared at CADCA's 2023 National Leadership Forum to over 4,000 coalition members, this is not a war on drugs, but a fight to save lives. Also, we need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine as a key emerging threat. and it is one which interacts with opioids in a devastating way that leads to overdoses. An example of the spread of this dangerous trend, some cities are reporting that drug samples they are receiving rarely contain heroin, while 99% of them contain fentanyl, and 4 out of 5 samples contain xylazine. In today's landscape, each one of us needs every tool available for saving lives and helping our communities recover these drugs crises. From one Hoosier to another, keep up the great work. I look forward to seeing you in person the next time we're all together. Thank you for having me on today. Back to you, Rachel.
Thank you, Valentino. Thank you for those remarks today. We appreciate you joining us. We are excited to introduce you to Director Douglas Huntsinger. Douglas Huntsinger serves as Executive Director for the Drug Prevention, Treatment, and Enforcement for the state of Indiana and Chairman of the Indiana Commission to Combat Substance Use Disorder. As a senior advisor to Governor Eric J. Holcomb and a member of the governor's cabinet, Douglas oversees the coordination of the governor's Next Level Recovery Initiative, aligning and focusing the state of Indiana's response to the drug crisis. He also serves as a member of the Justice Reinvestment Advisor Council and the Governor's Health Workforce Council. Organizations across Indiana have recognized Douglas for his efforts. The Indiana Judges Association made him the 2021 Champion of Justice in recognition of his work supporting family recovery courts and behavioral health services for justice-involved individuals and families. Overdose Lifeline recently presented Douglas with the Policy Advocate of the Year Award for his steadfast commitment to serving our most vulnerable Hoosiers. And Thrive Recovery Community Organization recognized him for his distinguished service, presenting him with the inaugural State Partner of the Year Award. We turn it to you, Doug.
On day one of his administration, Governor Eric Holcomb declared the drug epidemic a top priority, calling for all hands on deck to help the thousands of Hoosiers who battle this disease of addiction every day. We've made significant strides in the years to follow, but at a time when demand for services has never been greater, our partnership with Overdose Lifeline and the countless other individuals and organizations we're lucky to call allies are more important than ever in assuring Hoosiers a pathway to recovery. Under the governor's leadership, we've advanced programs and initiatives in prevention, treatment, enforcement, and recovery, dedicating over $1 billion to build out our statewide infrastructure. From opening opioid treatment programs to starting up our regional recovery hubs and expanding treatment in jails, we're working at each intervention point to make resources available to all Hoosiers, no matter what zip code they live in. Perhaps the effort I'm most proud is our ability to get naloxone into the hands of any Hoosier who needs it. When we started to see an uptick in overdoses at the onset of the pandemic in 2020, we leaned on Overdose Lifeline to help us get naloxone out the door and directly in the hands of Hoosiers. Given the lasting effects of the pandemic and the emergence of illicit fentanyl in the years to follow, overdoses continue to rise and the need for a life-saving naloxone intensified. 24,000 naloxone kits are reaching Hoosiers every month through individual distribution, 430 nalox boxes, 18 vending machines, and our expansive network of over 200 grassroots partners. With illicit fentanyl contributing to over 85% of all overdoses in Indiana, Overdose Lifeline continues to make fentanyl test strips available. And the recent threat of fentanyl combined with xylazine, an animal tranquilizer, has prompted us to make xylazine test strips available by request. Our harm reduction street outreach teams are complementing these efforts by handing out naloxone and fentanyl test strips to Hoosiers who are in active use. And our 11 mobile response teams covering 30 counties are following up with individuals within 72 hours of a reported overdose and connecting them with the full continuum of treatment and recovery support services. Our no wrong door approach ensures that Hoosiers have access to the full continuum of care, regardless of where they enter the system. Now, on behalf of Governor Holcomb, I could not be more proud of the work taking place across our state and help Hoosiers recover from substance use disorder. Because only together can we make Indiana a better place for all Hoosiers. Thank you.
Doug, thank you so much. Your work is so important in ensuring services are available for all Hoosiers and giving us a common direction as we confront the challenges drugs create for our communities. Next, I would like to introduce you to Fort Wayne Mayor Tom Henry. Tom Henry is serving in his fourth term as mayor of Fort Wayne. Leading Indiana's second largest city, Mayor Henry is making government the best it can be for residents and businesses by demonstrating a commitment to engagement, innovation, and performance. Mayor Henry has a strong record of success in neighborhood infrastructure improvements, downtown development, job creation, business expansions, advances in public safety, and enhancements to the city's world-class park system. Before being elected mayor, he served from 1983 to 2003 on the Fort Wayne City Council, representing Northwest Fort Wayne. Mayor Henry has lived in Fort Wayne almost all of his life and began his career in the private sector as CEO of a group purchasing organization serving hospitals. He then went on to become a successful small business owner of a local insurance agency and healthcare management consulting firm. Mr. Mayor, thank you for joining us today.
Hello, I'm Mayor Tom Henry from Fort Wayne, Indiana. I'd like to spend a few minutes talking to you about some of our action plans in Fort Wayne relative to some of the mental health challenges and some of the resulting addiction challenges that we have in our community, and again, how we're trying to address those in as positive a fashion as we can. What we decided to do in Fort Wayne from a governmental perspective is we've tried to identify what areas we could really be a partner in trying to address these new problems or again, challenges that we have in Fort Wayne. So what we've decided to do was, first of all, partner with our social service agencies. We're blessed in Fort Wayne to have a number of great social service agencies, some of them part of our United Way effort, some of them freestanding, some of them already in partnership with the federal government, and we've decided to become partners with them as well. So we meet regularly with a social service committee. There's about 12 different social service agencies that I meet with on a regular basis to determine what areas in our city can we as a governmental agency be of assistance, be of help to these organizations that are trying to address a number of the problems in our community. And unquestionably, mental health has risen to the top. It could definitely be a part of the results of the pandemic, among other challenges as well. But unquestionably, mental health is now a primary area of focus. Also, unfortunately, addiction in our community to a number of different drugs is becoming more and more prevalent, and we need to try to embrace that particular problem as well. So we meet on a regular basis with our agencies in Fort Wayne that work with those problems, and we try to make sure that we can assist them either through legislation, either through additional financing if we can, through working with personnel. For instance, I recently hired 2 social workers as part of my police department. I'm getting ready to hire 2 more. So we'll have 4 police officers who are actually social workers, and their responsibility, their goal is to be of assistance to our police department when our officers are confronted with problems that are a result of some mental health issues or addiction problems. Our police department, for the most part, our 500 police officers here are trained in public safety, in crime fighting, not in social work. So what we've done, as I mentioned, is hired now 4 social workers who work in the areas of mental health and addiction to now assist our police officers and also to work in concert with our social service agencies. So that's one area that we're trying to address some of the ills of our society through, again, partnerships with social service agencies. The second area where we've partnered is with our school system. We have a group of young students. These are sophomores, juniors, and seniors in high school. I put together a youth engagement council. There's about 25 of them from different high schools in the city. They meet every 2 weeks with my staff. And again, we try to address it from a younger perspective. They help us really get an inside look at some of the challenges, whether it's internet bullying, expectations of their parents or guardians as to their academic quality. We take a look at some of the subject matters that are taught in the high schools and whether or not these young people think they're relevant. And we also talk about pressures in this generation as a whole. And one of the things that these students have done every year now, and we just finished one, and we're getting ready to prepare for one for next year, and that is a mental health seminar. It's an all-day affair. These young people actually put together the agenda. They bring in psychologists, psychiatrists, they bring in police officers. As I mentioned, some of the social workers that we have through our police department, they'll come in and talk to these young people. And they break down into workshops, and the whole idea is to, again, try to get their head around the challenges of this particular generation. And we also take a look at some of our mental health challenges and addiction problems from a legislative perspective and what we can do to make sure that all of the materials that we can possibly make available to the public as far as not only educational materials, but Narcan, other types of drugs that might be available to help out individuals who sometimes are in a position where they're facing a real dilemma and they need to have access to something to help them out. So we're putting those things available throughout our community. We're going through training classes, even though it's rather simple to administer. Nevertheless, I think it raises people's comfort level. So legislatively, partnership with our social service agencies, a partnership with our educational system. We're trying to address all of those areas as best we can, realizing that even though we're government, we still have limited resources financially and otherwise. But this is an ongoing problem. I think it's going to be here for a while. And the more progressively we can address this challenge, the better off I think we're all going to be. I certainly want to thank everyone who put this program together. It's certainly something that's needed, and I really appreciate being a part of this offering. Thank you.
Thank you so much, Mayor Henry. Your investment in youth and engagement in the issues that matter to them serves as a testament to your dedication to our whole community and as an example to other officials. Your leadership here and in all of the other areas you work in, it's so deeply appreciated. Thank you so much for speaking with us today. Next, we turn it over to two of our amazing healthcare providers at Indiana University Health. These providers are working on the front line to provide care to our neighbors who need it the most. Dr. Camilla Arnaudou is an addiction psychiatrist based in Bloomington for the past 15 years. She completed medical school at the University of Maryland School of Medicine in Baltimore. She then completed her residency in psychiatry at Harvard Longwood Psychiatry Training Program in Boston. After relocating to Indiana and working as a psychiatrist, she returned to training and completed a fellowship in addiction psychiatry at Indiana University School of Medicine in Indianapolis. Her current work focuses on mental health and addictive illnesses in pregnant and postpartum people, with a particular focus on increasing equity and accessibility to quality care. She is currently the medical director at the Addictions Treatment Recovery Center at IU Health and a member of the Indiana Maternal Mortality Review Committee. She serves as co-medical director for the Indiana Consultations for Healthcare Providers in Addiction, Mental Health, and Perinatal Psychiatry Program, which is a statewide program providing consultations to frontline providers on treatment of psychiatric illness. She's been one of the main foundations of clinical practice facilitators for the Bloomington campus for the past 6 years and helped develop that course. She also contributes to the development of coursework for first-year medical students on communicating with empathy and cultural humility, helping encourage patient-centered care. Lori Terrell is the clinical manager for the Family Vitality Initiative at IU Health Community Health in Bloomington. Lori completed her bachelor's degree in healthcare administration from Franklin University and has over 28 years of experience in pediatrics as an office manager for Riley Physicians, formerly known as Southern Indiana Pediatrics, before transferring to work with IU Health Community Health. Lori has been actively involved with the pediatric and teen behavioral health domain, Monroe County Mental Health Task Force, Monroe County Substance Abuse Task Force, CARES Board, Child Protective Team, as well as the Child Fatality Review Team and the Fetal and Infant Mortality Team. Additionally, she has joined the newly established Suicide Overdose Fatality Review Team to serve on Monroe County. Throughout her work in pediatrics, as well as through life experience, Lori has developed a passion for individuals who struggle with substance and mental health issues. She's utilized this passion to help develop a pathway for care for high-risk pregnant individuals experiencing substance use called Moms Heal Together Clinic, where enrollees are able to receive support, education, medication services, and group therapy to help provide continuum of care through collaboration for those enrolled, reducing infant mortality in our area. Lori, Dr. Arnardo, we're so excited to hear from you.
All right. So I'm Camila Arnaudo, and I'm an addiction psychiatrist, and I work with perinatal patients in Bloomington, Indiana. I am also part of the Maternal Mortality Review Committee, and being on that committee has really given me some insight into what are some of the leading causes of maternal mortality during the first year postpartum. And one of those things is overdoses from opioids. Being a perinatal psychiatrist, I have been aware of this problem previously, but being on the Maternal Mortality Review Committee really highlighted for me just the magnitude of the problem, particularly in Indiana. And one of the things we noticed when we were reviewing cases was that some of these people were getting prenatal care, but their obstetricians or midwives or nurse practitioners or other doctors that were taking care of them didn't seem to know a lot about perinatal substance use disorder or mental health. And so one of my ideas or ways that I thought we could tackle this was by having what's called a perinatal access program. And these programs exist all around the United States. And so we decided that it would be good to have one in Indiana. And we actually decided that we didn't want to have it just for pregnant people. We wanted our service to serve all people in Indiana who had mental health or substance use disorder needs. And through a grant from the Department of Mental Health and Addictions, and in collaboration with the IU School of Medicine, Department of Psychiatry, we have created such a program here in Indiana, and we call it the Indiana CHAMP program. And it stands for Consultations for Healthcare Providers in Psychiatry, Substance Use, and Perinatal Disorders. It's quite a mouthful, so let's just call it CHAMP. And through this program, anyone who's a prescriber who works in Indiana, a doctor, a nurse practitioner, a midwife, a physician's assistant, anyone who's prescribing medications in Indiana, who is taking care of a patient who has either a general mental health condition or an addictive or substance use disorder type illness, can call this phone between 9 a.m. and 5 p.m. on business days and can get help with any question. Just before I was recording this spot, in fact, I did a consultation for a person in northern Indiana, a physician who was working in the hospital, had a pregnant patient, had a question about medications for anxiety, and we were able to talk through that case together and give her some ideas, which she can now try with her patient. And then she can always call the phone line at CHAMP back, and we can provide additional support if that's necessary. And so this is a free program available in Indiana to anyone who prescribes medications. And we just started in March, and we're just trying to get the word out and have people call us so we can help help them take care of their patients who have these diagnoses. We know that one of the reasons that make these programs really effective is that we know many people experience stigma related to mental illness and addictions, and they don't necessarily feel comfortable going to see a psychiatrist, but they will go and see their regular general practitioner or their OB to take care of themselves and to have a healthy pregnancy. So we know that if we can get the information to those frontline providers, it reaches a huge, much larger percentage of patients. And this is especially true in patients who are minoritized groups. They tend to be less likely to present to psychiatric care. And since they're dying at higher rates than other pregnant people, we feel that this CHAMP service has a chance to impact their health even more.
I am Lori Terrell. I am a clinical manager of a program at IU Health Community Health called Family Vitality. I previously have worked inside the system primarily in primary care pediatrics, where I saw the impact and after effects of individuals who had pregnancies and had substance use. So dealt with a lot of children who had experience with DCS, traumatic related issues and events related to coming in and out of households, mostly with substance. And in our local area, we started asking, what is it we can do to have a positive impact to the pediatric population we're serving? And that kind of came out as figuring out how we could build and have more supports before it ever became a pediatric need or a situation. So how can we help provide supports to avoid the family getting to the position where they were? So we worked to develop a program called Moms Heal Together. It is primarily served for individuals who are pregnant or postpartum, and we're very kind of loose in our definition of postpartum. So up to the child's second birthday, we consider them postpartum. And we work to enroll them into a group setting for clinics that during pregnancy, we supply some March of Dimes guidance in terms of the group pregnancy style model. And in addition to that, we also have a certified nurse midwife who is able to prescribe medication-assisted treatment for any of our moms who are experiencing opiate use disorder, to be able to supply medication-assisted treatment. At the same time, we give them some supplemental OB check-ins. So they're getting fundal height measurements, infant Doppler sounds, assessing for blood pressures, monitoring weight. We also do urine drug screens to help us in terms of our safety planning and just open conversations with our moms about what we might be seeing in terms of their experience with some struggles with ongoing use. And we also have a licensed clinical social worker who leads the group. And we have a 16-week topic curriculum that we go. We see them every other week. So it's technically over 32 weeks. And we kind of work on building their peer supports, their community. We do that as a in-person. The group lasts for about 2 hours. And our goal really of that is help them to establish a sense of community, develop their peer connections. What we really see is these moms are working really hard on their own health, and they have a desire to be healthy themselves, but to have healthy babies with healthy outcomes. And we want them to be able to come into an environment where they're not feeling judged or have stigma around their use, which we do see in the population, that being a very guilt-provoked conversation as they first enroll into us and feeling a little uncomfortable for that. So our goal is to try to help them get where they have, set their goals, work each individual. They can repeat the session with us and they can stay in for the entire 2-year period of time, just to be able to gain those supports and connections. We also have the ability to do some bridging services for those who also need individual therapy, because in our area, what we find for the South Central region of Indiana is there's long delays and wait times to get into connection for particular therapy services, especially given certain insurance company coverage. So we want to make sure we're able to supply those supports and get them on their path toward either building their steps toward sobriety or helping to them maintain and build their supports and connections for resources.
I can say one little final thing, which is that, you know, through the CHAMP program, we really hope that we can reinforce for all the other prescribers that are out there working with patients with mental health and substance use disorder diagnoses, that these are treatable illnesses, and that you don't have to be a psychiatrist or, you know, you don't need specialized training to help take care of these patients. You have a really important role in taking care of them by being their primary care doctor and being their, you know, frontline provider. And we're here to support you with the skills and the knowledge that you need so you can do that. And you can be a part of, of the solution for these patients.
Probably for me, the thing that I see the best is when we've had moms who have enrolled and their success and how they feel about themselves and how they're really able to celebrate. Maybe they still have, different struggles, or maybe they've had an issue where they've had a slight return to use of a product or one or another, but how they're able to build their supports underneath them and how that doesn't let them continue in a negative path. And then just seeing the interactions with them, with their babies. We allow the babies to come to clinic with them and just watch them. And many times we hear them make comments about how other people doubted their ability to be a positive parent. But through the supports, they're now starting to believe in the fact that other people believe in them as well.
Thank you both for sharing your insights into the amazing range of wraparound services you help provide. It's really exciting to know that people who are pregnant can receive some of the best care available in the nation right here at IU Health, all because of the cutting edge programs you have helped spearhead, and that all healthcare providers have access to resources to help grow their practice. I know this affects so many people in our community in Allen County, so your work is truly invaluable. Next, we will hear from our host today at Drug and Alcohol Consortium of Allen County. Monique Johnson serves as the Director of Associate Engagement for the Drug and Alcohol Consortium. Monique has experience in working with a variety of population and community systems to build upon the strengths of those with significant barriers to success. She is dedicated to improving outcomes for the Allen County community, particularly youth, older adult, and marginalized populations. At DAC, she oversees the Drug Free Communities federal grant, where she works with 12 sectors of coalitions to find innovative ways to combat youth substance misuse and underage drinking, and to reduce complex trauma for youth. Monique also manages Division of Mental Health and Addiction of older adults, and at DAC and assists with the Brave Alliance. She is an ACEs master trainer and provides both ACEs and substance use prevention training to organizations in the Northwest Indiana region. Monique, we're so glad you could join us today.
Thank you so much for joining us today. My name is Monique Johnson, Director of Associate Engagement at the Allen County Drug and Alcohol Consortium in Fort Wayne, Indiana. We're very excited to highlight some of our community partners and resources currently available in Fort Wayne, as well as to learn about naloxone and how to administer it in the event of an overdose. Here at the Allen County Drug and Alcohol Consortium, we strive to provide an effective network to collaboratively prevent substance abuse, primarily by youth, and to reduce the negative impact of alcohol and other drugs in the Allen County community. Primary prevention efforts are crucial to reducing overall overdoses. To that effect, DAC helps educate our local youth by administering prevention programming through local schools and after-school programs. The Boys and Girls Club sites across Fort Wayne and Powerhouse Youth Center in New Haven both implement the program Too Good for Drugs to children from kindergarten through high school. And our irreplaceable school resource officers teach Project Alert to the 7th grade classes in our public middle schools. Both programs are aimed at mitigating risk factors and promoting protective factors related to alcohol, tobacco, and other drug use, and help children develop skills for making healthy choices, building positive relationships, communicating effectively, and resisting peer pressure and negative influences. In an ideal world, that's where our job would end, but we're all too aware that additional resources are needed to help keep our population safe. DAC partners with local recovery houses and programs to provide intervention scholarships to individuals seeking help in overcoming addictions. We help with training for peer recovery coaches, and we support and encourage harm reduction efforts like needle exchange and safe use kits. Additionally, we act as an information clearinghouse for effective implementation strategies and policy change related to alcohol, tobacco, and other drugs in Allen County. One of the highest need populations we aim to serve are those facing discrimination in their everyday life. It's far too common for individuals of disparaged populations, LGBTQIA+, immigrants and refugees, and lower income and minority families to possess higher risk factors for substance use. For that reason, DAC places an emphasis on listening to those whose voices have been traditionally stifled. Through a Community Catalyst grant, DAC has recently opened the Brave Alliance, an LGBTQIA+ youth drop-in center, to help mitigate those risk factors and give at-risk youth a safe space to exist without the pressures of drinking or substance use. In addition to being a drop-in center, Brave offers mental health counseling, gender-affirming care, youth groups, and a lending library. DAC has partnered with Overdose Lifeline, who you will be hearing from shortly, to obtain and distribute over 1,000 free doses of naloxone to our community. Naloxone has been instrumental in helping address the opioid crisis due to its ability to reverse the effects of an overdose. The CDC estimates that naloxone has prevented at least 10,000 overdose deaths since 2014. With expanded access to this important tool, we can continue to reverse overdoses and save lives.
Thank you, Monique. It is such a pleasure to work with you and your team. And from all of us at CADCA, we'd like to thank you for all of your efforts in making today's event possible, and as well as for all the services you promote and provide in Fort Wayne. Next, we're also joined by Justin Phillips, founder and executive director of Overdose Lifeline. Justin Phillips is the founder and chief executive officer of Overdose Lifeline, a nonprofit dedicated to reduce the stigma of substance use disorder and prevent deaths resulting from opioid overdose. Justin holds a master's degree in clinical addiction counseling and a master's in philanthropic studies and nonprofit management. Justin is also certified in the grief recovery method and is a feature speaker on the national, regional, and local circuit. In 2016, Justin was recognized by the White House as a champion of change, one of just 10 leaders among the nation chosen amongst more than 900 nominees for their leadership in advancing prevention, treatment, and recovery. Justin, we look forward to hearing from you.
Hello, my name is Justin Phillips, and I'm the founder and CEO of Overdose Lifeline. We're a nonprofit based in Indianapolis, Indiana, and we've been in existence since 2014. And our primary purpose at the beginning of our work was to increase access to the overdose reversal drug naloxone. In October of 2013, I lost my 20-year-old son, Aaron, to a heroin overdose. And about 45 days later, I learned about naloxone, that it was something that could have saved his life, and that there were barriers to access to naloxone, such as the requirement of a prescription from a physician. My background is injury prevention and public health and grassroots advocacy, so it was a natural transition for me to go into this work to increase access to naloxone. We passed the law in Indiana in April of 2015, allowing naloxone to be over the counter without a prescription, and for agencies, organizations such as Overdose Lifeline to register as distribution entities with the State Department of Health. And we've been distributing naloxone ever since 2015 in a variety of ways. We're fortunate enough to have partnered with the state of Indiana and the Division of Mental Health and Addiction in the governor's office in June of 2020 to really exponentially increase access to naloxone. Currently, we distribute 24,000 doses of naloxone across the state of Indiana a month. And we do that because we have established grassroots harm reduction, boots on the ground partners in all 92 counties of Indiana. They know their community, they do the work, and all we do is support them with naloxone, harm reduction, technical assistance. We have a website, and if you go to the top of our website, overdoselifeline.org, You can find an easy link to find naloxone near you. We have a map showing all of those distributors. We have locations with what's called an nalox box, and we have 17 vending machines with naloxone. All of this is made available, again, as I mentioned, through our partnership with the state. You can request naloxone from us, and we will mail it to you free with no need for you to tell us who you are. And again, we do this because of these great grassroots partners and because everyone should have access to naloxone, no matter the barrier, no matter the time of day, whether or not they want to have to go into a place of business. They don't have to do that with the access to the nalox boxes. Overdose Lifeline is so grateful to our grassroots partners and the harm reduction, boots on the ground individuals across the state of Indiana. We wouldn't really be able to do this without their help. We know that lives are continuously being saved. We learned of someone just today who had access to naloxone and was able to save their cousin and told us that their cousin would no longer be here were it not for the access to naloxone. And our good friend and former Surgeon General, Dr. Jerome Adams, always says that you're more likely in this current climate to administer naloxone than you are to use CPR. And so we really encourage everyone, no matter where they are, especially in this current climate with fentanyl in almost every drug acquired illicitly on the streets, to have access to naloxone. Even if you don't think that you're susceptible to an overdose, one can never know. And this is an important life-saving medication that can make the difference. Nobody finds recovery if they're not alive. So thank you so much. And I encourage you to look at our website, Overdose Lifeline. We have lots of online learning and education that's beneficial, including a layperson naloxone course. So thank you. Have a great day.
Justin, thank you so much for speaking with us today, for your work with Overdose Lifeline. It's such an honor to work with someone who's truly a lifesaver and helps others become lifesavers as well. Our final guest speaker today, before moving on to the virtual reality demonstration, is Nate Mullering. Nate was born and raised in Fort Wayne, Indiana. He began his journey of struggle with substance use disorder at the age of 12, and it lasted until he was 24. Since then, Nate has found long-term recovery, devoted his life and career to helping others recover. In 2018, he was a founding member for an outpatient treatment program, Fort Wayne Recovery. Fort Wayne Recovery has continued to grow and led to the creation of Allendale Treatment, which specializes in detox and residential treatment for those with substance use disorder, as well as other mental health disorders. Nate is now serving as the Executive Vice President of Fort Wayne Recovery and Allendale Treatment. Nate also serves on the board at the 13th Step House, a featured speaker with Remedy Live, an illicit substance use expert on the Allen County Overdose Fatality Review Team, and a regular contributor on national news media outlets. He also helped to found Bare Knuckle Recovery, a social media platform that creates content on substance use and recovery and provides resource mapping. Through all these different avenues, Nate is able to work alongside many national, state, and local organizations, both nonprofit and for-profit, in the field of substance use and mental health. He is firmly committed to collaborative efforts when trying to tackle this massive crisis. Nate, we're excited to hear from you.
Hello, everyone. My name is Nate Mullering. I'm a person in long-term recovery, and I now work in the field of substance use disorder and mental health treatment. But as I said, I'm a person in long-term recovery, so I'll start there. I'm someone who struggled with mental health from a young age and turned to substances for relief. I got hooked on prescription pain pills in high school after I had some sports injuries. And then I went on to play college sports where I was continued to be, I was given extra painkillers so I could keep playing the sport that I was in, which was football, which is a violent sport. And that ultimately led me to becoming addicted to heroin. The prescription pain pill supply was 110% restricted. after about 2014 because they needed to shut down some of the pill mills, which was a great thing. But then I started using IV heroin and ended up, homeless multiple times. And eventually that led me to encountering heroin laced with fentanyl. And that is what led me to having between 5 to 6 incidents of overdose. Several of the times I was given Narcan, naloxone, if you would, and brought out of it by first responders. Unfortunately, that did not stop me ultimately, but it did keep me alive long enough to choose to go to treatment and to turn my life around. And, I think that's one of the most important things that we can touch on when we talk about naloxone distribution. We can treat addiction, but we can't treat death. And if I had never been given those opportunities, by first responders and multiple times, I know first responders get frustrated when they have to Narcan people multiple times. But ultimately, it gives that person a chance at life. We all make mistakes. No one in kindergarten, when you asked them what they wanted to be, no one said, I want to be addicted to fentanyl and I want to overdose and have nowhere to live. Most of them said they wanted to be a doctor, a lawyer, a nurse, a firefighter, a police officer, a vet. They wanted to help people. And that's what I wanted to do when I was a kid as well. But, obviously my mental health issues led me down a path of substance use, which ultimately led me to fentanyl and being a person that I didn't even recognize. I ultimately made it out of that. And today I work in the field of substance use disorder treatment and mental health treatment. I am the executive vice president of Fort Wayne Recovery and Allendale Treatment. I really got involved in community work when I started working for this company way back in the beginning, about 5 or 6 years ago, and began to meet individuals who were really grassroots organizations, which I think is really the backbone of the prevention and intervention, the recovery community. A lot of times those are the people that I work with in Fort Wayne, in Allen County, which is in the northeast part of Indiana. Groups like the Mom of an Addict, who mainly work with people who are the loved ones of those who suffer with substance use disorder and mental health. And the reason they picked the name Mom of an Addict was really to take the stigma away from the word addict. But they do an excellent job in naloxone distribution. Unfortunately, a lot of individuals who have to use, be revived with naloxone are, people that are in families, and the family members are oftentimes the one administering the naloxone. So that is one of the organizations that I work alongside with. And then also the Hope and Recovery team with the Fort Wayne Police Department. A lot of people give the police, the justice community a lot of grief for how they handle people with substance use disorder and mental health problems. But Fort Wayne Police Department has really tried to change the narrative. And part of that was because the man who saved my life was actually a Fort Wayne police narcotics detective who actually sent me to treatment instead of sending me to jail. And that was one of the first times that had ever happened in the area back in 2017. So then this program called the Hope and Recovery Team kind of spawned out of that idea where these individuals who were formerly narcotics detectives would go out in plain clothes with 2 social workers and follow up on people who had a non-fatal overdose and offer them naloxone, offer them access to medical care, offer them access to treatment, and provide them rides if they need, gas vouchers. Oftentimes I find myself going out with them, and what we do is we go from door to door in the motels here in Northeast Indiana, which are the areas most frequented by those who suffer from substance use disorder, those that are transient, that don't have anywhere to live, who are usually those at the highest risk for opioid overdose. Really getting the naloxone in the hands of those people has been vitally important. That also brings me to Project Me, which is run by Asha Dis. She is a person also in long-term recovery. She specializes in also helping people who are in the transient homeless population, getting them prevention kits, but specifically naloxone to help them, have the tools that they need in case there's a first responders are unavailable or they're just with their peers, which oftentimes we know most overdoses occur when we're with our peers. So those are the organizations that I work alongside. And then in my work, I do a lot of intervention work. I do some inpatient treatment, some outpatient treatment with the facilities that I work for. And, fortunately, most of the people I treat are alive because of naloxone. I deal with a lot of people who have fentanyl use disorder. along with other opioid use disorders. And the large majority of those people have had an experience with naloxone and been revived. And it's given them the opportunity to access treatment. As I said previously, we can treat addiction, but we can't treat death. So keeping people alive as long as possible, in my opinion, is a really big deal and something that we need to focus on, with the utmost intensity. I think that there are some arguments out there by people who would say that naloxone simply encourages more drug use. I have found that to be completely false. Most people who say that have never actually been had naloxone administered to them while they were under the influence of an opiate. It is actually a pretty terrible experience. It makes you instantly ill. So the idea that anyone would look forward to that or use with that in mind, that they can just be Narcan and brought back, is simply ludicrous in my opinion. So I think that Indiana has done an excellent job of giving out naloxone. There's so many different RCOs and grassroots organizations in this area who work extremely hard to make sure naloxone makes it into the hands of people who need it the most. So, if you're out there and you're unsure about naloxone, I would encourage you to educate yourself. Make sure you get some because you're more likely to encounter somebody experiencing a medical emergency that requires naloxone than you are to come across someone experiencing a medical emergency that requires an external defibrillator, which is clearly saying something. So get out there, get educated, arm up with some naloxone, get trained on it, and go out and support any of your local grassroots organizations that are quite literally, in my opinion, saving lives and giving people the opportunity to access services that they will ultimately need. It's hard to get people to do it against their will. But what we hope is that at some point people will be sick and tired of being sick and tired, which is where I got to. So go out, get involved, join the good fight. We need your help. We need everybody's help on this. I think in 2021 was the first year that over 100,000 people in the United States died of an opioid overdose. So we need you. We need your support. And I appreciate you all being willing to be here today. Thank you.
Thank you, Nate. We couldn't be luckier to have you in our community. We're wishing you continued success and hope you can continue to spread these messages. We'd like to thank all of our speakers here today. Each one of you have done so much to raise awareness and expand services in this challenging environment. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, which includes the use of virtual reality. The virtual reality program was developed as a tool for training to build skills in unique situations that are hard to replicate in a classroom setting, such as Black Friday trainings. This technology led to the development of non-retail training, such as the VR that we will view next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Dude, your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay. Jay. Wake up, man. Wake up or I'm calling the cops. John. Hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We're so excited to work with you and connect this training with community members. We'd like to thank our friends at Drug and Alcohol Consortium for hosting us tonight and connecting with such an esteemed group of speakers. And to all of you who attended this event, we truly appreciate your time. Please reach out to CADCA, to me, Reiko Mendoza at CADCA, RMENDOZA at CADCA.org, or any member of my team to find out more about what we can do together to learn more about these events and how we can work to stop overdose. We're now through the hour and we will conclude the webinar. I wish you all a great week.